I'm Dr. Lavina Noronha, and I've been here since the inception. I'm a director of Ave Maria Palliative Care. In fact, I was in the U.S. I was working for a hospice where I got an idea that we need something like that in India, in Bangalore. Yeah. They said, we just send them home to die, and then there is nothing. What about palliation? What about hospices? We don't have anything like that. We just do whatever we can and keep them with us, and then we send them home to die. And then when we, in the US, we have at every primary health center level, we have a hospice. So it was not heard of, we have to do everything we can and not just give up on our patients. I said, no, it's not giving up. Because all illnesses, especially in end stage, fourth stage, it's not curable. So sometimes you have to accept the reality and tell people that we cannot cure. There is no answer. So we have to do something about it. And I said, no, that's not our job. This cough is going to irritate me. So then a couple of times I came here, and then that just gave me an idea. Why not come back and do something? Because my hometown doesn't have a palliative care center or a hospice. In 2006 I resigned. I was teaching in the university, and on weekends I used to work for a hospice. So I just resigned from my job and came back in November 2006. 2008 we started the place. It was up and open for service. So we've had about 980 patients who've died here since 2008 September. And we take care of cancer patients, we take care of other terminally ill patients, renal failure, liver cirrhosis, liver failure, those who are in coma, brain tumor, malignant brain tumor. So people who are in end stages only we take care. Where there is no hope for cure, we just care for them till they die. So we have a huge team with us, and we have 16 staff working for us. We have nurses, we have a visiting doctor, we have 2 social workers, 2 housekeeping staff, 2 kitchen staff, a facility supervisor, and an ambulance driver and a vehicle driver. So it's basically a team approach, holistic approach. We have to prepare people to die, because it doesn't happen overnight, it takes some time. Most of the time they've been lied to, they don't know that they're going to die. Because people just believe in instilling hope, sometimes false hope. And so they have to be told that nothing can be done, and this is the end. If they have anything to be finished, they can fulfill that or finish their unfinished business. So they need a lot of psychological support, a lot of legal assistance sometimes, moral support. Family members need a lot of help. Most of our patients are very young, 35 to 50. And most male diagnosed with oral cancers. And when that happens, they have small children, so their spouses and children also have to be prepared. And for them also the reality is very bleak, and it's very difficult to accept that they will not be around to see their daughter graduate from high school, or they will not be there for her marriage. But that's, they have to accept that, even though it's painful. So we do a lot of counseling, we do a lot of group support and prepare the family members. Allow the family members to be honest with them also, with the patients, and tell them that we've done whatever we could, now there's nothing more we can do. So basically that's what we do. Some people can be fed orally, like you and I eat regular food. Some have to be fed through the nasogastric tube because they have oral, esophageal, neck, throat, gum, palate cancers. So they are given liquid food every 2 hours. Some are able to move a little bit in the bed. Some are partially mobile with support. Some are totally immobile, totally bed bound, so they have to be shifted every 2 hours. We have to do their position change. So this is what the nurses do on a daily basis. And food in whatever way they can eat, we give them. So solid food, semi-solid food, liquid food, and sometimes it's just through the IV line when all that option is not possible. So till the end, basically average stay I would say is about 3 to 4 weeks. But a few patients have stayed up to 4 years with us. But some people die in 10 minutes after moving here. Some die in 24 hours or 2 days, 1 day. So average is about 3 to 4 weeks. In 4 weeks, we have to get them ready physically, psychologically, emotionally, legally, spiritually, holistic help.
So what kind of families come here, ma'am? Is it particular, like what's their economic state of the families who put their relatives here in this institution?
Most of the people are middle class and lower middle class also. It's not that they cannot afford to take care of their family members and they want to dump them here. Some of them are very affluent, but most people, even average income people, by the time you finish chemo, radiation, surgery, transfusion, you become lower economic status. Your economic status changes because of the treatment and all the aggressive interventions. So we don't charge them anything, it's free. So if they have money, they can give as donation. But there's no bed charge, weekly charge, monthly charge, nothing like that. It's open to people of all ages, provided they have something which is not curable and which is terminal. So our youngest has been 4 years old, oldest has been 99. So between 4 and 99, it's open to people of all religions, Hindu, Muslim, Christians. All people come here, people of all walks of life. Playing every day, they can listen to music, they can play carom, they can play cards. We have a lot of visitors coming in, they bring, people can come and play the guitar and sing for them. They all like that. That day they require less pain medication. And in fact we had one gentleman who was having dementia, end-stage dementia, and a group of students from a local engineering college had come to visit. And they were just singing all 60s Hindi songs, Hindi movie song, and he is from the 60s. So that's what he grew up with. So they sang one song, and after that he called me aside and said, "Madam, how much do they charge per song?" I said, "They don't charge, it's not for money. They just play." Then you ask them to play this song and that song, and he gave me 4 requests. So this person with dementia, he remembered all those songs and that he really liked. And then after that, this group used to come every week. They said, "No, we'll come every week and we'll spend some quality time with them. We don't lose anything because we are musicians. We love singing and we love playing." So, and then there is somebody who's appreciating, people who are appreciating, and that day he says, "No, don't give me morphine. I want to be alert because Thursday afternoon they come. So if you give me pain medication, I'll be sleeping. So I want to listen to music." So that kind of, there are a lot of alternative ways of bringing about that peace and comfort, more than medication. It's not, palliative care approach is called low-tech, high-touch approach. So you touch the patient, you massage their hands, we do a lot of physiotherapy, recreational therapy, music, there are groups coming in, They can watch TV. Every room has a television set. So whatever channels they want to watch, they can watch. So it's not like, they're just looking at the wall counting their hours or counting their days and wondering when they're going to die.
And
Not that way.
there's even nature around.
Yes, some of them can be wheeled out in the garden when they are not in too much pain. They like, in the mornings, they like sunlight on them, so some vitamin D also. So that just brings about a lot of change. So apart from medications, and we also fulfill their last wishes. And one of our brain tumor patients, she was only 19, and she was fond of strawberry flavored ice cream. And she was being fed through the nasal tube. So when she was sinking, because anything that we gave was coming out from the mouth, so we stopped feeding her. That means system is shutting down. The digestive system is not working. So we stopped feeding them, and we informed the family member. And her mother said, it will take me about 40 minutes to get there. So her favorite is strawberry ice cream. I would really love for her to have strawberry ice cream before she goes. So can you please make sure that she gets strawberry ice cream? And the nurse is trying to explain to the mother, she's not able to take anything orally because we are not even feeding her through the nasal tube because it's coming out from the mouth. That means her digestive system is shutting down. You try. So we sent the supervisor to the grocery store nearby, and then he was able to get a cup of strawberry flavored ice cream, and she ate the whole cup orally. She had not taken anything orally, and she relished every bit of that ice cream, and then she smiled and she died. So when the mother reached the facility, we told her you were 2-3 minutes late. She just breathed her last. The mother asked, did you give her ice cream? And yes, she had a whole cup of strawberry ice cream. Yes, it's okay. So mother was happy, sad that her daughter died, but happy that she had her favorite ice cream before going. So those are their wishes. They don't have any 5-star.
Little things.
Yeah, small things which matter.
So ma'am, how do you take care of the family, like after the patients die? The family might be going through a very bad period. Do they also, counsel them?
Yes, we have grief support group for the family. We invite them to come and talk to us. And some of them really call us also and tell us how they are doing. Every month we check on people. Some people are okay. They are well prepared psychologically, spiritually. They are strong. They can manage on their own. They tell us, no, we don't want to come. We are doing okay. Some people call us and say, I need some help. What can I do? I want to come there and volunteer, because now I feel at least that way I can give back to the center. So that also people have expressed an interest to volunteer with us also. So we encourage that. They come for meetings, grief support groups. Children also come. We used to do children's camps to children whose one of the parents had died here. So we brought them during summer, and that this place is not the horrible place which took their dad or mom away, but this is a nice place and you can have fun also. So we did a 3-day camp for the children. There were a lot of children at one point, 15 to youngest was 3. So we all engaged them whole day, and a lot of things. Cooking without fire, and some games and music and drama and lots of things. And then they also got an opportunity to talk about how they are feeling. Oh, your father also died. Your mother died. I feel like this. So it's good sharing they had. It was a very enriching experience.
Ma'am, since you're part of such a thing, what are your views on life and death? Since you've seen so many things, your views about life and death would be so have changed. Like, just asking this is my first.
No, not really, because life is very precious, and death is just a part of life. It is not the end of life. I feel death is another chapter begins after death. So that's what I believe in, and we have to do everything we can to make life enriching for people, and that's what we do. We try our best to add life to their days, not days to their life. That we cannot do. So even if they have 12 hours, it can be very meaningful 12 hours for them. If they have 12 days, we can also work accordingly. So it doesn't matter how you live. We all believe, and I personally believe, how you live is more important than how long you live. So you can do whatever you want. But these small things matter a lot. No regrets, whatever happens, you settle it that day, because most of the people think that before I die I'll do this, before I die I'll say sorry, before I die I say thank you. And sometimes they just die, there is no opportunity. And in palliative care you get all these opportunities to say sorry, thank you, all those, which is not possible if you die in a motor vehicle accident. So it is 2-7. So this is in some way anticipatory grief, anticipating death is much better, because it makes families, they bond together, they are stronger and they can endure anything. We feel that children also are very resilient. We've seen some of the little kiddos, little children who are diagnosed, and one of the girls had, she was 9 years old, she had multiple myeloma, sort of aggressive bone cancer. So she was with us, and every time her mother would go into her room, so mother was staying with her here, and mother would tell her, no, you're not going to die, you'll be walking one day. And so she called me and said, you please counsel my mother, she needs some counseling, tell her I'm going to die and I'm okay with dying, and tell her to be okay with that also, because there is no need to tell me that I'm going to be alright. Doctors have told me, I know that I'm going to die and I'm not afraid. So she needs more support than me. So this 9-year-old was very mature emotionally. Mother was not ready to accept that. So sometimes it amazes us how resilient, how strong these children are. And they are talking about big things, and all other 6-year-olds are silly. One fellow, his mother was dying. And one day she was sinking, she had breast cancer, she was only 29. Our youngest breast cancer patient some years ago, and only son was 6, and he was taking care of her, because when the doctors told the husband that your wife has cancer, it has gone to the bones, she has less than 4 months to live, husband just deserted her in the hospital and disappeared. Nobody could find him, so we don't know. Even the family members don't know what happened to him, whether he was in a state of shock, he couldn't take it, that's why he disappeared, or he died, or he ran away, he didn't want to take responsibility of his wife. Nothing is known. So she was from the hospital, they did a mastectomy on her, just a palliative mastectomy, so that her pain will be, because it was oozing a lot. So mastectomy would help with the pain, so not to cure, because curing was not possible, it had already gone to the bone. So this little fellow was staying by her side and always trying to press her hands and legs, because she had excruciating pain. So at some point she would tell him, his little 6-year-old hands, 5-year-old hands were not making an impact. So she would tell, hold on to the side rails of the bed and jump on my legs, waist to the toes and toes to the waist. And he would ask, Amma, are you sure? Yes, it makes me feel good. So then she would go slip into sleep, and then she'll start snoring, he will stop, and he'll be sweating from jumping on her. So this was his way of pain relief. And massage was not helpful because it's bone pain. So one day he was praying by her bedside, and before I go home I just say bye to all my patients, because I don't know how many of them will be alive the next day. So I also don't know whether I'll be alive the next day. So that's it works both ways. So I say goodbye to everybody, and I was looking at him, he was deeply engrossed, he was kneeling by the mother's bedside and he was lost in prayer. So I asked him, you were praying, what were you asking God? And he said, oh, nothing. No, I know you were seriously having a conversation. Are you asking God to cure your mother? He said, no ma'am, I know she cannot be cured, doctors have told me. Are you asking God to keep her as long as possible, because father is gone? Now mother is going and I'll be all alone. He'll be an orphan basically. He said, no. You want to know what I asked? I was asking God to take her as soon as possible. So he's only 6 years old, and he had the wisdom to let go of his mother. And I said, you will be all alone, father is gone. It's okay, I can handle that, but I cannot handle her pain. Anyway, he has decided to take her. So I'm just asking him, make it fast. Don't torture her more. So you can see the level of wisdom of children and the resilience also. Even adults don't have that kind of guts. This little fellow, he was adopted by his uncle, maternal uncle, who's a tailor, and he brought him, he's bringing him up. Now he's in first degree. So he was only 6 years old when this happened. When mother died here, and he was spending his weekends here taking care. So this is, all this keeps us going also. We are doing something meaningful here. We are not making a lot of difference, but we've made a difference for one person. So he still calls and comes once in a while. So there are many children who remember us, and they come and say, I'm in college, I'm doing my post-graduation. One fellow wanted to kill himself along with the children. He was 39. He had 3 children. One was in 10th, one was in 6th, one was in 2nd. So he told the wife, we have lost everything for my treatment, oral cancer he had. He was a bus conductor by profession. So anyway, I'm going to die. I don't know what you're going to do with these 3 children. How are you going to feed 4 mouths? Already we are neck deep in debt. So you bring 1 tube of rat poison and bring some Marie biscuits. We'll make sandwiches, we'll make the children eat, and we'll also eat, and we'll all go together. So that wife, when she heard that, she knew she's in dire straits, desperate situation. But still she had presence of mind. She came running to my room and said, ma'am, he's asking me to bring rat poison and bring children Saturday afternoon. And he's saying we'll all go together. Anyway, I'm going to go, but I'm afraid whether you'll be able to make it without me, with all that debt. So we'll all go together. So I asked her, so are you going to bring it? She said, no, I don't want to die. I don't want to kill our children. It's not fair. We feel sad that he's going. And I said, good for you. You go and tell him. And he asked her, what are you going to do? You don't have any skills. She was a homemaker. He was the only provider. So finally, she said, I know how to wash dishes. So I will wash dishes in people's homes, and I'll make ends meet. I'll make sure that children stay in school. They will not quit school. So he was satisfied. You have everything figured out. How are you going to manage? You don't have a house. House was mortgaged. It's okay, we'll stay in a rented house. Only skill I have is I can wash dishes. So if I wash dishes in 5 homes, I can manage to put food on the table and pay their fees also. So their oldest is a college professor now. One was in 10th standard. Mother is still washing dishes in other people's homes, by the way. She said, no, I will not quit that. Daughter tells her, hey, Mom, you don't have to do it. I have the means to provide. She said, no, it's okay. That's how I raised all of you. That's how I paid fees and put food on the table. So I will continue as long as it's good for me. So I feel good doing it. So don't worry. You go to college. Are you ashamed that I am washing dishes in other people's homes? She said, no. That's how I became a college professor. Because you washed the dishes. So it's okay, you continue. So there are a lot of good things that come. Cancer is bad. Terminal illness is bad. But there are some, they are the real heroes. I really feel these patients and their family members, and that 6-year-old, and this woman who had lost everything, who didn't have a job, who had never worked in her life. Suddenly she has to be the breadwinner and the homemaker and a father and a mother to her children. 3 children, 4 mouths to feed. But still she said, I can still make it, do something. So cancer brings the best out of people, I would say. It just helps you take life in stride. And it's different for everybody. So they are stronger because of the illness. The family is closer because of the illness. So they will not die. They will not say, I quit. Because they know, they have fought, they've been hit hard, and they know how to survive. So that keeps us going also. These are all wonderful things. People change their life around, and that keeps us going, so we can offer our services to more people. So people also ask me sometimes, how do you sleep at night? Do you take tablets to sleep? I said, no. I just hit the pillow and I'm gone. But so many people die here. Yes, but I don't kill them. We don't kill them. We give them the best care possible. And with that satisfaction, I go to sleep. So I will never need medication to sleep. I can sit and sleep, I can stand and sleep. So people always think that, yes, seeing death is painful. 1, 2, 3 deaths sometimes in a day. Sometimes there is no death for a week or 10 days. So every day is different. Even for the nurses, it just wears them out emotionally. We're all humans. So every death diminishes us. But then, we look at the positive side. Because of us, just 2 days ago, a patient was admitted. He has throat cancer. And there are maggots in his wounds and they're crawling all over. And the nurses have to pick them out. And he was just taking something, what was he using? From the bandage because those things are moving in the wound, they are going into all the crevices of his throat, nasal cavity and ear canal also maybe. So he's feeling irritated. So he took something which was there, teaspoon. And with the teaspoon he is trying to dig them out. So, I don't know, something is crawling. So, no, we'll take them out, no problem. So you put neem oil and they come out and you clean their wounds and that's what happens. So,
what's the vision of this place in the next 5 years? Where do you think this place would be heading? Do you plan on expanding this institution, or maybe within Mangalore itself, maybe have another institution?
No, institution, we are only a 15-bed facility. We don't want to extend and institutionalize people. So what we've done is we've started home-based care. So we send our team of nurses, social worker, doctor also comes. We train family members how to do the dressing, how to monitor their blood pressure. And sometimes they are brought here when our services are needed. Otherwise, they can be taken care of at home. So we encourage a lot of that instead of abandoning. So when they have bed sores, when they have maggots, they are brought here. So once we clean it, family members can manage at home. So we encourage that, and we do a lot of home-based care also. We provide home nurses to be in their homes, so the family can get some assistance to take care of them, bathe them, shift them in the bed, move. Yeah, we had 2 patients with oral cancer. Both were being fed through the nasal tube because they could not take. One had cancer of the hard palate, which had spread to all the other adjacent places. One had a buccal mucosa of the cheek, so he had undergone surgery. Both were referred here with a letter saying they had 30 days to live, end stage. They were with us for 4 years. Even the doctor was surprised, because one person, the one who had CA of the palate, even his tongue was missing, it was gone. And then people would ask him, what cancer you have? And he would open the mouth, there is nothing. Part of the gums, part of the tongue, part of the jaws, upper palate, lower palate, everything was corroded and gone. It was one big cavity and his nasal tube was going to the stomach, so he was being fed. So it was just how he was alive and how he was surviving. He was on pain medication, but he accepted his illness. The other person also same thing. It was also, when he was brought horizontally. Then he became alright, he was walking around, he was watering our garden, he was taking bath by himself, making his own bed, eating food orally by, solid food. So tube also went. So how this happened, don't know. So those 2 patients were there.
Do you think that after coming here, their improvement in their emotional health actually impacted on their physical health as well?
Possible, because they are at peace here, people don't consider them as burden. Even if one person was working as a watchman in a building, apartment complex, and he had a drinking problem earlier also. He had not done much. His wife and children had abandoned him. So he was all alone. His apartment complex owner brought him here. So, but he was happy that he was in a good place, and we became his family, even though his family was not there. So then he just accepted. So basically, when you fight the diagnosis, the distress is more. Once you accept it, it's okay. They said I'm going to die, but I'm not in a hurry to die. When it happens, okay, let it happen. But there's no fear, there's no anxiety about dying or death, nothing. And both did not have a lot of family support. Nobody was coming to visit them.
Ma'am, how the whole thing get, like, how the money comes to, give the medicines and food and everything?
We operate on donations,
Then
so people give more than what we require. Initially, when the building just got finished, we had about 65 lakhs debt to the contractor. But then eventually we were able to pay off the debt, and now we don't even have any needs anymore. So people are comfortable. We get about 1,79,80,000 goes in salaries every month, plus patient care, feed, foods, medications, diapers. But we are able to manage all that with whatever money comes. So we're not asking for any funds, no government assistance. It's just private. People come here, see the work. Sometimes people come and see the work and they have money. So they say, some of them put us on their will. So only when they die or when some other family member dies, we know that we have inherited some fixed deposits or their assets. So that's how we are able to manage now. So there is no dearth for funds at all.
Thank you so much.
Thank you
ma'am.
so much.
And
You're
it was
welcome.
so lovely.
Ma'am,
They have done everything they can. So there's a lot of stigma associated with palliative care. And family members also feel that we are abandoning our loved ones in that institution. In the end stages, we did not take care. So some of them really feel a lot of, they feel guilty for doing that. And that interferes with their grieving also. Extended family also blames the family members. Why are you taking him to that place? Why can't you take care? But they will not come forward and assist them in taking care. They'll only give advice. So many times people, even in the end stages, and even medical professionals, fourth stage also sometimes chemotherapy, radiotherapy is advised and tried. There are many patients who die after one shot of chemotherapy when your hemoglobin level is too low. So sometimes it's it's commercial also, because there is government assistance for chemo and radiation. So the hospitals will force patients to go through chemo when they don't really need it, and they die sooner because of chemo than they would otherwise. So that's also there. So there are a lot of issues involved. So we have to make ethical decisions. If it's not going to make any difference to the patient, why impose chemotherapy on the patient? If it's going to improve their quality of life or quantity of life, no problem. But if it's not going to do anything, just so that you can fill the bed and keep going as a hospital or a healthcare facility, that's not fair for them. Whatever little they have, it'll disappear. And when they don't have anything, they are told, you take them home, we can't do anything now. So at least give them some quality time. So there's a lot of awareness which is needed, even for the family members as well as healthcare professionals. It's important to be honest with them. Don't lie to your patients. Don't tell them it's okay, you'll be all right. It's a matter of 1 month, 2 months, and then keep on using them as guinea pigs. It's not fair. Because then you don't even give them a chance to prepare for death. They don't say goodbye hoping that they're going to get better. So hope is good, but false assurance is not good. False hope is not good.